So, Governor, as always, we appreciate it when you come on the show. And I do want to start because we have a lot to talk about. Let's start with marijuana in the budget. You have recreational and medical in the budget. Republicans have told me this is not going to happen. I'm sure you also knew this. So why did you put it in the budget?
Well, I'm not a pessimist. There are lots of people in the state of Wisconsin that have passed a referendum or have weighed in on the issue of recreational marijuana, and so the people talk during this budget time. It's not Republicans and Democrats talking to each other. So I'm anticipating that there'll be a good push to get it through, and it makes sense. We're surrounded by states that have recreational marijuana, and it's time to make that change. It can be an economic boost for our state.
Have you thought about going about this in a different way and not doing it in the budget? That seems like the deal breaker, considering Speaker Vos says he's open to at least medical marijuana. I mean, you don't need to worry about Senator Fitzgerald anymore. Have you thought about doing this outside the budget?
Well, yes, but to be honest with you, and every person in the Capitol knows is that policy is primarily made through the budget making process, and this is obviously a policy issue that has significant financial pieces as part of it. So it needs to be here. There's no reason why it can't be part of the budget, and I'm hoping to get it done. If the legislature wants to take it up and pass it outside the budget, I'm more than willing to do that. But it makes sense to me. It's connected. There is a revenue source and obviously some expenditures involved.
Well, I'm curious too, if you put recreational in there, hoping that maybe then there'd be some kind of compromise and they would just go for medical.
Well, it's not a compromise position. If it was, I would just put the medical in there like I did last time, and that didn't happen. So I'm open to discussion, but the fact of the matter is there's lots of people, polling, referenda across the state. This is the people's budget. It's not mine or the legislators. And what I'm trying to do here, kicking it off, is representing the interests of the people of Wisconsin. We've done listening sessions all across the state, and recreational marijuana always comes up.
I do want to talk about some other things that you've released ahead of your budget address on Tuesday, including Medicaid expansion, money for long-term care, child care, an increase in sales tax. Unfortunately, we don't have time to talk about every single one, but what would you say is your top priority that you would go to Republicans and tell them this is the one thing I really need in here?
The Medicaid expansion clearly is tied to so many other things. And I'm not just talking about the financial sanity of it. Clearly Medicaid expansion will allow us to recapture taxes that the Wisconsinites have paid into federal government without getting any return on it. But it's connected to making sure that we have a solid healthcare system in the state of Wisconsin, that we're addressing some of those disproportionate health outcomes that we have every place in Wisconsin, whether it's Black, Brown, Indigenous peoples. It doesn't matter. We need those resources, but we also need to have that connection to the Medicaid system so that we can accomplish these things. So that is a top priority. I know the Republicans call it welfare. It's not welfare. We've already paid for it. We've been paying for it for decades, and it's time for Wisconsin to join the vast majority of the rest of the country. Many of those are red states, and there's no reason why we don't.
And I'll be asking Representative Bourne about that coming up here in our next segment. But when it comes to the vaccine distribution, the numbers are getting much better in Wisconsin, going from the CDC ranking us one of the worst to one of the best. But now the state just released that vaccine dashboard showing who's getting the vaccine, and it's easy to see that there's a problem with racial disparities. I mean, it shows almost 11% of white people have received it compared to just 3% of Black people. We're all seeing these numbers now out in the open. How long have you known about that gap?
Well, in some cases, it's been not surprising, the numbers themselves, because they collecting it in that way wasn't the most transparent. But making the transparency and making sure that everybody knows that. I've known that for a short period of time, but it also was self-evident when the very first part of the campaign to vaccinate people dealt with healthcare workers and people in nursing homes and EMTs and first responders, all which are primarily white folks. But it made sense to make sure that they are taken care of first so that they can take care of others. But that said, we have to do it differently, and that's why we have gone to giving more vaccines to those federal clinics that we have in underserved parts of the state of Wisconsin.
How much time do you think it'll take to close that gap, get that closer?
Well, as we move forward, it's going to take some time, but we're already starting that process, Adrian. And as I said, we're putting more. Vaccines are a very short supply in the state, but we are moving more into those federal clinics. We are making sure that we have those mobile units fully stocked. And so we'll be seeing more and more of the people of color getting those vaccines. But it is going to take time, just like any other group. We're doing 30,000 to 40,000 a day, and it's our hope to do a much better job in that area, and we've begun that process.
Well, Milwaukee County ranks really low in terms of getting the vaccine, and it's the most diverse county in the state. So
Right.
how do you get, and Milwaukee County officials are very upset about this, how do you get more to them?
They need to ask for more. Bottom line, we every week or every 2 weeks, I'm not sure the cadence, but the vaccinators in the state, we ask them, what do you need? And we try to meet those needs. But we have been proactively sending them to places where the economic disparities are very, very evident.
So you're saying it's Milwaukee County, it's on them to be asking you for more?
Of course they need to do that, but we are also preemptively doing it on our own. And I'm not blaming anyone here. All I can say is that we receive requests. We try to respond to those requests in the most efficient way. We want to be partners with Milwaukee County and the city and so on and so forth. So we will continue to do that. But asking is part of the process. That said, we also, with the data that we have now, we are directly reaching out to those clinics that serve those populations. In fact, just the other day, I opened up a community clinic in Rockford, Rock County in Wisconsin because of that very reason. There's a preponderance of people there that aren't part of a health care system, have no health care insurance at all. And we're reaching out to make sure that happens. We'll continue to do that, but it is a two-way street.
There's still so much confusion for people in terms of how to go about even getting this vaccine. I know that you're working on a statewide vaccine registration website. So what's taking so long, considering we've known about this for almost a year now, and when will that be done?
Well, we started out with the healthcare providers all across the state, whether it's the big companies that have health insurance and insure most of the people in the state. Those folks, they're reaching out and they're doing their job. So it's not that we haven't forgotten anybody. It's just that it takes time to get the cadence going. As you said before, we led the nation last week in the per capita vaccination of folks, and we hope to continue that. But what is preventing it? You think about all the people that have yet to be vaccinated. It is in the millions in the state of Wisconsin. There is no surplus of vaccines in this state or any other state of the union. The previous administration left the cupboard bare, and Joe Biden and his crew are trying to catch up. But it is going to take time. We plan on, after the 1st of March, moving to a different category, and that cadence will take some time. It will be summer, there's no question about it, and unless we get more vaccines, and it looks like they cut a deal with the companies just yesterday, that we will be seeing more in the future.
When do you think the website will be ready, though, the statewide registration website?
Well, I'd say in a very short period of time, but we have to have places for people to go and vaccines for people to receive once they get there. So we could have that reservation system in place and have not the places to go or the vaccines in particular. So we're doing all those things at once. I think the registration will be ready in a couple of weeks at the least. But those that registration system has not prevented us from leading the nation in the number of vaccines per capita in the last week. So that has not stopped us. What has stopped us is the number of vaccines that we receive.
And Governor, as I talk to you now, you're about to get your first dose of the vaccine. And in your age group, you've been eligible for this for a while.
Yeah.
Was that hard to wait? And what are you expecting when you get it?
Well, it's interesting. It's going to be soon, like today, later today. We didn't jump any lines. Our healthcare provider sent us a long letter about 2 months ago, I think, or a month ago, saying, "Don't call us, we'll call you." So we just cooled our heels until our time came. And I understand how people are concerned about this, but frankly, both Kathy and I spend a lot of time wearing a mask and doing the things that we have to do in the meantime to make sure that we're health and safety, and our health and safety is in a good place. So I just encourage people to be patient. We're doing the best we can, and we are moving forward at a good clip now. But this clip will just barely break the surface of moving us together as a state. We need more vaccinations.
How is Mrs. Evers doing after her first dose? You said she got that a few days ago.
Yeah, she did great. Just a sore arm, that's all. No, she's pleased with the results, and I'm sure I will be too. But I just want people to be rest assured we did not jump any lines.
Well, President Joe Biden will be here on Tuesday, the same evening as your budget unveiling. Do you think you'll get any time with him? Will you get to talk to him?
Well, I probably on the phone. I'll probably catch up with him before my budget release. And I have to tell you, one of the refreshing things is in the change of administrations. It's just the outreach that they have and the consistency with the message, and frankly, the clarity and the honesty with the message. And so I know I'm a Dem and he's a Dem, and people will say, "Well, you're saying that because you're a Democrat." I'm not. I'm just saying that it's not solving all the problems, but the fact is there's much more clarity and much more directness from this administration that has been very helpful.
If you do get to speak with the president, I'm sure it won't be for a long amount of time. What do you want to communicate to him? Will it be send us more vaccine?
Absolutely, and I'm sure he's heard this a lot, and that's why he announced yesterday that he did another deal with the drug makers to bring more to all of the state of Wisconsin. But I think I'll probably get down in the weeds a little bit with him to make sure that he knows how important it is to focus on people that have struggled with COVID-19 the most, and that's our people of color in the state. And that's frankly why they announced last week that they're working directly with Walgreens in this state and across the country, with Walgreens that are located in areas of the state and our nation that or people that struggle mightily economically and otherwise. So I'm going to be talking to him about that very issue you and I talked about a minute ago.
And Governor, I just have two more topics to get to. Sure. I do want to ask you about the mask mandate. Your emergency order, Republicans overturned it. You issued a new one. What if they overturn that?
Well, they could, or it's likely. At the end of the day, they and I can go back and forth on this forever. But the Supreme Court of the state will make the final decision because that's where all these lawsuits are ending up. And so we'll wait for them we'll continue to insist on people wearing masks across the state. We have great support for people. I don't know why the Republicans continue to challenge it, but that's what they're going to do. I know they're going to do that. People have to wear a mask. It's so important. It's the most important part of this campaign around the issue of getting shots in the arm. The most important part is wearing a mask. Well,
and we've had a debate about it up front here, and Republicans say it's not about masks. It's about your powers and you going beyond your powers. So why not try to work with them before you extend another emergency order?
Well, I don't know how to work with them. They don't want to require masks. They have said time, and I know they're using that as kind of a front that, oh my God, Evers has taken over and he's a dictator, all that kind of baloney. The fact of the matter is they could pass a law tomorrow saying it is important for people to wear a mask in the state. We mandate it. they could allow us to go through the rulemaking process and go have an administrative rule around this. They say do it, but then the people that are in charge of that committee say over my dead body. So I'm not quite sure exactly how we resolve this. All I know is resolution to this issue or not, anybody that's involved with the healthcare industry will tell you the most important thing to get this virus under control and continue to squeeze it out of here is to wear a mask. And I'm going to stick up for the people of Wisconsin every time I get a chance to do so.
Last thing, you vetoed the Republicans' COVID-19 bill. Where are we now with that?
Well, I'm encouraging them to come back and pass the ones that we all agreed to. We agreed to more than 20 different pieces, all three of us. And there's absolutely no reason why we couldn't do that. That's what compromise is. What can we all agree on and leave the other things we can't agree on to the side? We were at over 20, and I'm encouraging them to come back, be in session, pass those 20, and I'll sign them.
All right, Governor Evers, we appreciate your time today. Thank you.
Thanks, Adrian. Have a good day.
You too.